Hello, how are you doing today? This is Dr. Leisegi. I decided to make this video since you guys have the letter that's in the office, but many patients have questions about the letter, so I wanted to address it in more detail. So as you can see, I am doing a change in the practice with new marketing, and we're changing it to Concierge Internal Medicine and Primary Care a la carte. What does a la carte mean? Means I'm gonna give you concierge level care, which involves seeing you the same day if you're sick. I'm gonna not make you wait, and also I'm gonna give you more than 5 minutes, which I have already been doing for over a decade, but nowadays it's called concierge. The only big difference is instead of paying a monthly membership, which is what you usually do in concierge, in my case it's like a hybrid in the sense that it's called a la carte, which means I give you concierge level care. However, it's pay as you go. I do not take insurances anymore. Starting either January or April, I will let you know. This applies obviously to Medicare since I have not been taking insurances now for many years. Let's go ahead and dive in. Since 2015, so you guys understand what happened. What's been happening is they decided that we're gonna pay you per performance. That means the better your patients are doing, the better payment we would receive. So this sounded excellent to me since I always take very good care of you guys. So I was like, okay, so they're gonna check my charts, they're gonna check your blood work, they're gonna talk to the patients, they're gonna do a survey, something like that, satisfaction. But no, it's not like that how it works. It's pretty much coding and coding. When I talked to Medicare, they told me, well, pretty much if you have a patient with heart failure or had a heart attack, then that's a code. And then you add another code for taking an aspirin. So when you add those two codes together, that means it's quality care. So you have to send us those codes. So there's no chart review, there's no talking to patients, or not looking into blood work or your blood pressures, nothing. So pretty much this is impossible to follow unless you have a coding department. When I talked to Medicare, they told me I had to set up a coding department. So this is a huge administrative demand. Already, I have seen a reduction of over 20% of what I get paid from Medicare, and it's gonna get even worse. We can see it with this email I received recently. And this email, as you can see here, so by 2025, it's another 9%. It says that physicians who perform well on reporting are awarded a bonus payment, and bonuses are funded by the penalties collected from low-performing and non-compliant clinicians. I am considered a non-compliant clinician since I have not been participating in these changes. So after learning this, I called Medicare and asked them, hey, so what do? I don't have, the ability to do all this coding. Either I see patients or I do the coding. I already have to do all the other coding for the diagnosis, and so I can submit the bills. And I don't even have a billing department in my practice. I actually have an outsourced billing company that collects 5% of everything that I make. And on top of that, some of the secondary insurances, I always have trouble collecting the whatever they pay, which is usually like 20%. And from that, they send me nowadays virtual cards, which is like a credit card that I have to process, and they take off another 3 to 4%. So it's like crazy. So he told me, sir, but just set up a coding department. I'm like, well, it's impossible for me to set up a coding department if I don't even have a billing department. So I just decided since then to just increase a little bit the volume. So, but going forward, this is not viable for me. It's just getting very difficult to continue practicing the way I'm doing. So I needed to come with a new solution for what's happening with Medicare and overall with all the insurances. And I decided to just become free market and simply stop taking insurances. So This is very important. I'm an internal medicine physician. I'm not family practice. I'm not a general doctor. I'm actually a specialist in internal medicine, which means I manage pretty much all the specialties. So I tend to not refer too much out because I enjoy managing most of the complex conditions. For example, I'm not going to scope you or I'm not going to perform a catheterization on your heart, but I know how to manage the conditions. So this prevents you from just being referred over and over to different places. One, because I have the capabilities of treating you, because I have the knowledge and now the experience of practicing for 16 years, but also because I have the time, which is very, very important. If I only have 5 minutes total to see you, I'm just immediately referring you to a neurologist where you're just going to show up there. You're going to probably see someone, and the second you start telling them that you're there for a headache, they're gonna have a piece of paper just with a headache protocol. They're gonna ask you, you're here with a headache. You're gonna say yes. Okay, it's headache protocol. So you gotta get an MRI, MRA, EEG, and a set of blood work that probably I already did. And then you're gonna come back after you do everything, and they're just gonna tell you, well, everything was normal. And that's it, and you kind of don't have many answers. You just spend a ton of money, and then maybe one of the labs are abnormal, and they tell you, "Oh, your sugar was high." So what does that mean, doctor? And they're just gonna send you to the endocrinologist, and then you're gonna show up to the endocrinologist, and they're gonna ask you why you're here. Because I have high sugar, and they don't know why. The neurologist sent me here. So then he's gonna say, so you have high sugar. So let me do my diabetes workup, and he's just gonna go diabetes workup, do all the bullet points on the workup, and then your white blood cells are going to be a little low, and then you're going to come back and they're going to tell your white blood cells are a little low, and guess what, they're going to now send you to the blood specialist, and on and on and on. So I'm not only saving you time, which is super super important, I'm saving you money, and more than anything, I'm saving you peace of mind, because all the time that you're going through all this workup, you're just getting worried of what may happen, and you may have questions, but they don't have the time to answer them. As you have seen, we sit down, we go over all the labs on detail, point by point. I want to make sure you understand when you have an abnormal result, probably means nothing, and if it's abnormal, maybe it's something there to consider, but we go through every single point because I want you to understand what's happening, so you are involved in your care. Also, I'm very excited that now I have implemented access to all the radiology places. So we're looking at MRIs, CAT scans, all the cuts. I show you where the anatomy is so you can understand on the CAT scan where's your kidney, where's your liver. Not only we're looking at, say, if you had abdominal pain at the organs that could be causing the abdominal pain, we're also looking, hey, do you have any plaques of cholesterol on the arteries that we can see? Do you have anything else going on? And an anatomical abnormality that happens in your family. So it's very interesting. Patients are really enjoying when we go through the MRIs and CAT scans, and they can actually see their heart. They can actually see their lungs. So on that's when I'm telling you this is gonna get even better. Also, as the letter says, we use GoodRx to explore affordable medications. So, because I have the time and not just 5 minutes, if we're putting you on a drug, we help you search where is it cheaper, so you can get the medications you need. Also, some patients that are looking for different type of insurances, I educate you regarding health savings accounts, and perhaps seeking reimbursement from the insurances. We provide you anything that you need. If you get any bills from Quest, any bills from any radiology place, we make sure we help you out to the maximum extent of our capabilities to ensure that those tests are covered. So we're going to help you as much as we can with any bill. And that's what we have always done. Please understand the changes in my practice are not because I want to increase the revenue, because I want to make more money or anything. This is really survival. I want to remain independent. all the changes, all the policies, as I state in the next point of the letter. With Medicare's policies, a notable reduction in reimbursement. Pretty much only the larger establishments have been able to navigate these challenges because they have compliance department, they have coding departments, they have law firms, they have all the resources so they can satisfy the metrics imposed by Medicare that I cannot comply with. So as you have seen, many doctors, many practices are now owned by big corporations. We pretty much are around 10% of the practices that remain like me, especially solo practices, are pretty much going extinct. And practices that don't take Medicare and insurances, I'm probably at the 1% of practice at this point, based on the research I've done. So in light of these challenges, I have made the decision to opt out of Medicare. This change will be effective whenever they tell me. Most probably going to be either January 1st or April 1st. I don't know. It's the government, so I don't know how long that's going to take. Hopefully it's not until the quarter after April 1st. But I'm notifying you because I really want you guys to understand what's happening. If you decide not to stay in the practice, this gives you ample time to find a new provider, or this gives me ample time to do these videos, to discuss the changes with you. I don't want to lose you. I want you to stay in the practice. You are the most important thing to me. So believe me, I want you to stay with me. I don't want you to leave me. This is gonna be amazing moving forward. And I appreciate the privilege of being your doctor. So in order to make this simple, as I state here, the rate is going to be $200. And everything will still be covered by Medicare. I am the one who's opting out. So pretty much my services, when you come into the office, my consult, my bill that would ordinarily be paid at around $120 or so, that will not be covered, and my fee will be $200. Why $200? It's going to be flat. It's going to be if you're coming in for a broken nail, or if you have a complex discharge from the hospital with a bunch of records, that's still $200. I just want to make it easy. Like I told you before, in the practice, I do all this. I do the IT. I do all the marketing with his video. I do the payroll. I don't have an office manager. I pretty much do everything. So I don't want to also be doing the accounting and having to add extra dollars here for an EKG done or this urine test or whatever I can do in the office. I'll include it on the price. The EKGs, injections, urine dipstick, everything will be included on the visit. The $200 covers everything that I can do on that visit. And of course, if you have a wound, an infection, and I want to see it in 2 days just to make sure it's healing properly, because I'm concerned, I want to be able to sleep at night. I'm going to tell you to come back in 2 days. I will not charge you. I just want to take a look at it. You have your blood pressure very high. We need to make sure your machine is working. Bring your machine. We'll check it side by side, make sure it's fine. I'm not going to check you. I'm not going to charge you for that. So just basic things, I'm gonna be covering on the visits, and I just wanted that to be clear that those $200, they're not cheap. I am saving you money based on everything that I'm discussing on this video, in comparison to going to the hospital or not having access, and for the quality of care you're getting. However, I understand that fee. That's much higher than what you may be paying somewhere else. It's giving you the peace of mind that you have access to me any day. You want to see me today, you want to set up an appointment for tomorrow, guarantee you we have space for you. $200 may sound like a lot. However, this allows me to just keep very few patients a day, and that way I ensure that you can be seen the same day if you're sick or the day after. So if I charge less, say $70, then I would need to see triple the volume. And if I see triple the volume, well, then I wouldn't be able to accommodate you if you're sick. So pretty much this $200 are covering you in a concierge level care. This concierge level care usually is around $3,000 to $5,000 in some markets. You have services like MD VIP, Prestige MD, Signature MD. This concierge services, usually the rate is around that price, and that's that's a lot of money. I think if you see me twice a year, which is what my average patient does, that's $400. That's not bad. You see me 10 times, that's $2,000. That's still cheaper than a concierge service, and you're still getting all the major benefits of the concierge services. I sat down with a couple of them that wanted me to join them because they don't have anyone in Port St. Lucie, and I asked them, well, how am I going to sell this to my patients? And they told me, well, tell them you're going to see them the same day. Tell them they're not going to wait. Tell them you're going to give them more than 5 minutes. And I told them, well, I already do that. So since I already do that, pretty much I'm going to be telling them, okay, now it's going to be $3,000 for the same service. So this doesn't make sense to me. Plus, the other thing is, if I do concierge, let me show you guys here. If I do concierge, I can only take with me around 300, 500 patients because I need to really deliver a higher level of care, in the sense that if you're mad at your team not scoring a touchdown on Sunday night and you punch the wall, then you're gonna want to FaceTime me and want me to come to your house so I can check your hand. And for that reason, from my 2,875 patients, I can only take 300 to 500. So what happens to the rest? Well, even if the price is 10,000, 15,000, 20,000, whatever it is, I can only take that amount. The rest would be left without a doctor. So, and in my personal case, I want to be able to scuba dive, be underwater 2 hours, and you're not going to get upset because you called your concierge doctor when you needed me and I was underwater and I didn't call you back immediately. And so it gives me good quality of life. So it's better for me. It's better for you. You're only paying $200 every time you see me versus $3,000. So it's a win-win situation. I think it's cleaner. Plus, if I have someone that cannot afford the visit, they can pay me. I have a financial payment plan where you can pay me $40 a month. Also, you want to pay me with a banana, you want to bake me a cake, that's also possible under Medicare. If I don't charge someone, or if someone pays me with a cake, I'm discriminating against all the other patients that don't pay me with bananas. So that's actually illegal. And the other thing that's illegal that you may be wondering is, why, if Medicare pays you $100, why don't you just bill us the rest? And that's called balance billing, and it's also illegal. So I cannot do that, which makes a lot of sense. In other countries, they do that. You can bill on top of what the insurance pays, but here in America, it's not. So that's the reason why I decided this model of a hybrid called Concierge Internal Medicine a la carte. So going on with the letter, I want you to trust me. I want you to understand why I am doing this. I've been working very hard to establish my practice since 2010. I have a 3-year-old daughter, 8-month-old baby. Believe me when I say this, I don't want to sabotage my practice at all, because this is a huge leap for me. It's scary to go forward, not taking Medicare and no insurances at all, but I need to do it. And that's going to be better for me and better for you guys if I can stay here. I don't want to be an employed physician somewhere else. So to close, why am I taking the time to do this video and the letter and everything is because I really, really want you to stay in my practice. I want you to consider reconsider if you're considering leaving, just knowing that by staying with me, I'm going to give you the best care, the best quality out there. You're going to be getting concierge level care at an affordable price. Very, very affordable. To give you an idea, most patients that go to the emergency room, they go to the emergency room because their doctors cannot see them. So they call the office. They say you don't feel well. They're having chest pain or whatever. They go to the emergency room, and the average emergency room visit is $6,000. That involves hours in the emergency room where they're going to do a basic metabolic panel. They're going to do a basic CBC. They're going to do an EKG, maybe a chest x-ray. You may see a nurse practitioner. And then you're going to be sent home and tell you to follow up with your primary care. Just not having that access, that's $6,000. $200 is my visit. 10 visits with me are $2,000. If you see me twice a year, 10 visits are 5 years. $4,000 is 10 years. 15 years of seeing me are $6,000. 15 years. So who's expensive? Plus, they didn't take care of the problem. Now let's assume, I'd like to give you this example. You go to the emergency room. They put a catheter or a stent because you have a kidney stone. So the urologist comes in, puts a stent, which bypasses the stone. And the stent is left there. They didn't really take care of the stone. Stone is still stuck there. I see it all the time. They're going to tell you to follow up with urology in a week. You're going to call their office after going to the emergency room and spending $6,000. And they're going to tell you, well, we cannot see you until like 4 weeks from now. You're going to say, but they told me in the hospital I had to see him sooner. Well, sir, we don't have anything available right now. So if you don't feel well, go back to the emergency room. And there you go again. You think now they're going to take care of you. So you go back. They do all the tests. The same test they did before. They notice your stent is fine. Maybe some discomfort because you have that piece of plastic lodged in your ureter and the kidney and the bladder. So they give you maybe a little anesthetic and they send you home with antibiotics. Follow up with the urology in a week. You're going to call again the office and the same story. Well, sir, if you don't feel well, go back to the hospital. So you're going to be fed up. You're going to say, you know what? I'm going to go see Leisei. He can see me today or tomorrow. Going to come in, going to analyze the situation, and I'm going to write on my plan, like I always do, where you can see it on the screen share. I'm going to write, Dr. X, put this stent, and this stent should be removed in a timely fashion. Otherwise, my patient can lose his kidney, can get a major infection with sepsis, which is the infection going into the bloodstream. He may end up on dialysis, or he may lose his life. It's unacceptable. This is not taken care of in a timely fashion. And I'm going to tell my girls to fax that to Dr. X. And guess what? Dr. X already has me on his shit list. But you know what? I don't care. Because I don't work for Dr. X. You know who I work for? I work for you. I work for you. I don't work for any insurance company. I don't work for any corporation. I don't work for pharma. And certainly I don't work for Dr. X. Because tomorrow Dr. X will be Dr. Y or Dr. Z. You know, still it's unacceptable. I need to fight for my patients. And after sending that letter, they're going to see you tomorrow or the day after tomorrow. And they're not going to like me. But like I said, I don't care. So saying that, understand, I work for you. I don't want to lose you. Let's continue together. It's going to be good. It's going to get better. You're going to enjoy more and more coming here. Pleasure. Take care.